Miss Stone will be right here. Want to get comfortable?
On the average, 18 seconds is all you have to describe your symptoms to a physician before being interrupted by that physician. Typically, the doctor is more interested in the technical facts written on your chart than he or she is in what you have to say about how you're feeling. But Dr. Christina Puchalski has a different approach, one she first developed 20 years ago at George Washington University. Instead of focusing exclusively on science and facts, Dr. Puchalski discovered the importance of incorporating a patient's faith and spiritual beliefs into their care and recovery.
I really didn't care if people thought it was a crazy idea, which many people did. There was something inside of me that was just a driving force that says, healthcare cannot be like this. Medical education cannot be only on the technical. We have to do something different.
Dr. Puchalski's first love was science. Before earning her medical degree, she was a research scientist at the National Institutes of Health.
And I just remember one guy in particular, very, very bad deformities from his rheumatoid arthritis. Hands were gnarled. He couldn't really walk comfortably. He was on a lot of pain medication. And yet, when we started talking about his life and listening to his story, he had an amazing story of someone that accomplished a lot as a human being, and also he was an artist. So to see some of his paintings on the wall and then these gnarled hands, and you just wondered how he was able to do that. He wasn't angry at having an illness, and he talked about essentially spiritual values. So a couple years later, when I went to medical school, I was struck by the absence of anything having to do with humanity, quite frankly. As a second-year medical student, I thought we need a course on spirituality and health, and that's what started it all, really, was what I learned from patients at NIH and from people, and recognizing that we need that as part of our healthcare system.
I came to Dr. Puchalski by default. I've been at GW a long time, and the doctors kept changing. I would get a good doctor, and then they would leave. So I'm trying not to get too touchy-feely close to her because, she'll probably leave too. So anyway, but she broke down that that wall I was trying to build up, and she just kept talking nicely and sweetly, and she would ask me little different things, Do you do like a prayer or meditation or something on it? So, and then she learned more about me and how that I was, a devout Christian. I love the Lord, and that, I really depended on Him for my life.
In the mid-90s, Dr. Puchalski created a screening tool that would help physicians quickly develop a deeper rapport with their patients. Since all the data showed that a person's religious or spiritual beliefs were extremely profound in their recovery process, Dr. Puchalski set out to codify the way in which physicians could tap into the power of their patient's own healing potential.
It's just a tool, but you can use your own words. It's not meant to.
It's called the FICA tool, and it requires a physician to ask a few simple questions of each patient. Do you have any religious faith or spiritual beliefs? What influence or importance do those beliefs have in your life? Are you part of a community, such as a church, temple, mosque, even a yoga group? And finally, how as your physician would you like me to address these issues in your care?
I knew that I had to make it practical and accessible, and that was exciting for me, to take something that had a very personal meaning to a lot of people and make it commonplace, so that any doctor, nurse, social worker could say to a patient, so tell me about your spirituality, and not have it be, okay, now how do I define that word, and is it going to be a 25, 30-minute discussion, but rather this is such a normal part of life, I'm going to open up the question and listen to the person's story. And I think it goes back to what I learned at NIH. By listening to that gentleman's story, by listening to that artist's story and hearing how he coped with his illness, I really learned about who he really was as a human being. And I firmly believe that listening to our patients' stories is the way to be excellent physicians, nurses, social workers, and other healthcare professionals. We have to listen to where our patient is first, and then combine that with our training to create a plan together. And then we'll figure out where to go from there. You will be all right, I know that. And we'll do this together. We'll just, figure out. You don't have to make a decision about the surgery right now.
I knew something was wrong because I'd lost my appetite. I was avoiding people. My weight was less than it had been when I enlisted in the Army 60 years before. And I just knew that things were not right. One of our daughters described a friend of hers who had been to a doctor at GW. I went in to see her, and she gave me a whole hour that first time. And at my request, at one point, she prayed with me. And I knew that I had found something. A week or two later, I went back to see Dr. Puchalski. Well, she can be as gentle as a kitten. She can also be a drill sergeant. And I walked in and she said, "How's your weight?" I said, "It's better." "How's your appetite?" I said, "It's improved." "And are you back to daily mass yet?" Well, this said volumes to me, that to her, my spiritual life, which meant a great deal to me, meant as much to her and as much to my recovery as getting off the 3 medications that were causing depression. I just saw Dr. Puchalski last Wednesday, and I remember, and I told her so, in the morning I was thinking of coming in and seeing her, and just thinking of her, I smiled and I felt better. And I've never had a doctor that brought that reaction out of me before. And she has just not only cared for the whole person in all that time, but in the process has made me more of a whole person. And for it, I am eternally grateful.
It started with my daughter. I had gone to the market. She had her stand at the Farm Women's Market, and I went to pick her up, and I said, I haven't felt well. I have this pain. Then I threw up. And Susie said, "Mother, I'm not taking you home. I'm taking you to George Washington University Hospital." And she called Christina. I didn't share in all of this religious belief. And I wanted her to know, because if it was going to be uncomfortable for her to deal with me, it's something we should lay out right away. She said, "No, Jane, I respect you for for the way you are, and you get to make your own choices. I don't make choices for you." I mention that because I think it's important for the people who don't have strong spiritual beliefs not to be left out of this paradigm, because there really is a place for everybody in this.
Okay, what are we trying to do? This is going to be something for each course.
In 2001, Dr. Puchalski founded the George Washington Institute for Spirituality and Health, or GWish. GWish is working toward a more compassionate system of healthcare.
That's okay, because you're going to go in there.
One of the things that can make change, there are always people that have to be kind of a catalyst, in making change, but there's got to be a champion that makes change. Now, spirituality is not a new idea, but having a champion for what we know is important, and that's what it's taken. It's taken a champion to take that message out, within GW and make changes, and outside of GW, in every medical school in the country, every medical school in the world.
At this point, we've probably educated thousands of medical students who are now residents or practicing physicians. This is a phenomenal change. In 1992, there were 3 schools with courses. Ours was the first one on spirituality and health broadly defined. That means that new generations of doctors are learning that this is just a natural way of practicing medicine, the whole person.